Hey class, in this recording we're going to start focusing on some of the specific regions of the digestive system. So up here we have the mouth. The mouth is also known as the oral cavity, sometimes also referred to as the buccal cavity. Buccal is a term for the cheek. So the cheek cavity or the cheek pocket, you can think of it as that as well. And as we look at the mouth, or our oral cavity, its primary function is ingestion, getting food into the body. Some secondary functions include taste. We have some sensory responses to food, like salivation. We begin chemical digestion when we salivate our food and expose that food to the digestive enzymes of our saliva. We begin mechanical digestion when we chew our food. And then we take that chewed up food mixed with saliva and swallow it. We also are going to use our mouth for respiration, breathing in and out, and for speech to make those funny sounding noises. One of the unique things about the human mouth is that we have cheeks, and cheeks allow for us to store food in our mouth and give that food extra mechanical digestion as we masticate it within our mouth. We also have lips. On the lips of our mouth, we have the superior and inferior lip, or upper lower lip. We have a palate that's broken up into hard and soft regions, and then tongue, which can move the food around within the mouth while we're chewing it or masticating it. As we look at our mouth, it has two kinds of tissue that line it. We have a stratified squamous epithelium. The keratinized stratified squamous epithelium is present in the part of the mouth that has a lot of abrasion. So we have keratinized stratified squamous epithelium at the gums, also known as the gingiva. And we also are going to have stratified squamous epithelium at the hard palate. The hard palate is right up here, and it's going to have bone directly superior to it. I don't know about you guys, but I think this happens to me pretty much every time I get Cinnamon Toast Crunch, one of my all-time favorite breakfast cereals. It's really hard for me to stop with just one bowl, and while I'm chewing on that cereal, oftentimes it'll make the top of my mouth hurt because I'm exposing my hard palate to too much abrasion. We also are going to have a non-keratinized epithelium, stratified squamous epithelium, and this is going to be in parts of the mouth that don't have a lot of abrasion, like under the tongue, or the soft palate, or the insides of our cheeks. These areas of our mouth don't have a lot of direct, hard abrasion, and consequently, or a lot of friction applied to them, and we don't need to have as tough of tissue there. As we look at our tongue is very muscular and bulky. It used to be really common to find beef tongues for sale at the grocery store, but it's becoming less so now. And as we look at our tongue, it's broken up to two big areas. We have the root of the tongue. Let me back up a slide here. We have the root of our tongue, which is going to help anchor it into the oral cavity and the pharynx. And then we have the body of the tongue, which is going to be the part that can extend upward into the oral cavity. As we look at the tongue, it's going to be used to manipulate food, to move it around between the different regions of the mouth, so we can have different kinds of teeth to mechanically digest the food. We use our tongue for sensing taste and texture of our food, and we can take food particles that get stuck in our teeth and use our tongue to help clean our teeth out after our meal. Our tongue is going to be completely covered with a non-keratinized stratified squamous epithelium. So our tongue is not necessarily made to handle most of the abrasion in our mouth. The purpose of the tongue is to take something that we're chewing and move it over to the teeth and let the teeth do the dirty work. As we look at our tongue, it has some lingual papillae. These lingual papillae are the bumps. So a papilla is just a little bump. Lingual is a root word that means tongue. The tongue is the organ of language, and lingual and language have the same Latin root. So the lingual papillae are bumps on the tongue. And this is where most of our taste buds are going to be located. We have different kinds of lingual papillae. We have the valate papillae, the phthalate papillae, and the fungiform papillae on different regions of the tongue. Valate papillae being the large ones on the posterior, phthalate being the ridged ones on the lateral margins, and fungiform being the teeny tiny ones on the anterior margin of the tongue, or the anterior part of the tongue. As we look at our palate, the purpose of the palate is to separate the oral cavity from the nasal cavity, both the hard and soft palate. And this makes it possible for us to breathe while we are chewing food. And this is important. We need to be able to breathe while we chew food. If we don't have a fully intact palate, maybe we have a cleft palate, there's some kind of a cleavage within the palate, or some kind of a portion of our hard palate missing. Individuals with cleft palates have a very difficult time breastfeeding while they are an infant because they can't suckle and breathe through their nose at the same time easily. So these individuals, thankfully, now can oftentimes get cleft palate repair surgery. I have a couple family members who've had repaired to a cleft palate, and they can live totally normal lives afterwards. The palate can be broken up into two regions. We have the hard palate and the soft palate. Our hard palate is going to be made up of the extensions of the maxillae and the palatine bones. As we look at the soft palate, our soft palate is going to have some skeletal muscle tissue, giving it some framework and some glandular secretions. A key thing to emphasize with the soft palate, which is more posterior compared to the hard palate, is that there is no bone within our soft palate. Soft palates are soft because they have no bone. The soft palate terminates with the uvula, and that uvula hangs down in the posterior of the mouth. If you watched Looney Tune cartoons when you were smaller, the uvula was that thing that would sometimes you'd see little cartoon characters hitting it back and forth, kind of like a punching bag, or a boxer hitting a punching bag. And the purpose of that uvula is to help keep food in the mouth until we are ready to swallow that food. One second here. As we look at the teeth within the oral cavity, our teeth are broken up into three primary regions. We have the crown, which is exposed on the surface. We have the root, which is buried deep down in the mandible, and then a skinny little portion called the neck, where we have the gingiva, the gum meeting the crown of the tooth, or the tooth itself. So as we look at the root, that root that's deep down in the mandible is going to be embedded within alveolar bone. And this is a special kind of soft bone designed to receive the roots of our tooth. We also are going to have a gingival sulcus. Think back to when we covered the nervous system with the brain. A sulcus is a shallow indentation. This is a shallow indentation in the gingiva, the gum lines. And we have that gingival sulcus. Let me clear the screen here. Right there. It's a shallow indentation between the tooth and the gum line. And we need to keep our gingival sulcus cleaned out. We need to have good oral hygiene so that we don't have food build up in the gingival sulcus, which would lead to bacterial growth and the decay of the gingiva, exposing the neck of our tooth. As we look at the tooth in more detail, we find that the tooth has enamel on its surface covering the crown. The enamel is the hardest tissue in the human body. And then as we look at deep to the enamel, we have a lot of dentin, and that's the yellowish tissue. It's kind of hard, not as hard as the enamel, but it's still fairly hard. I remember the last time I was getting a cavity drilled out. The dentist was drilling in my mouth, went through the enamel, and then he had to keep drilling through the dentin to really just kind of roto-root the whole area out and then fill it in with a ceramic filling. And that, I remember being very surprised that he had to drill through the dentin. But I also remember the amount of smoke coming out of my mouth while he was drilling changed dramatically. When he was drilling through the enamel, there was this fine dust coming out of my mouth. And then when he got to the dentin, there was no more fine dust coming out of my mouth while he was drilling out my cavity. We also are going to have cementum. The cementum is going to cover the root and anchor the roots of our teeth within the alveolar bone. Both the cementum and dentin are living and can regenerate. This is good news. So if something has gone wrong with your tooth, maybe you've had some bad hygiene, or maybe you had an owie, maybe you got punched in the mouth and cracked the root of your tooth, it is possible to regenerate a damaged tooth. It's unlikely, it doesn't happen very often. Usually if it's been cracked or damaged, chewing will just make it worse and the tooth will oftentimes die, but it can regenerate. We also have a root canal, and that root canal is a space within the root that leads down to the pulp leads to the pulp cavity of the crown. So as we look at our root canal, this root canal, I'm going to shift colors here to bright yellow, and let's make it a little bit wider here. So we have the root canal right here, and this root canal is going to extend all the way down to where we have arteries and veins and nerves supplying food and nutrients and innervation to the tooth. That root canal will lead all the way up to a pulp cavity, which is going to contain a lot of the vasculature of the tooth. The inferior, well, I suppose it depends if you're looking at upper or lower jaw. The tip, we'll call it the apex of the root, ends with the apical foramen, and that apical foramen is going to be a small opening at the basal end, the end away from the lumen of the oral cavity, that allows for the blood vessels and nerves to go in and out of the root. When we close our mouth and our teeth match up just perfectly, there's a special term that describes that perfect matching up of our teeth, and that is occlusion. We want our teeth to be occluded. If we have too much of an overbite, an underbite, or a side bite, we don't have proper occlusion, and then it's very difficult for us to chew our food and mechanically digest it. As we look at our mouth is disgusting. We have well over 700 species of microorganisms that have been documented to live in the human mouth. Of that, most of them are bacteria. Those bacteria in our mouth can feed on food to make a sticky residue known as a plaque. And it's going to be made up of the bacteria in our mouth plus the sugars from the leftover food that are present within our gingival sulcus. And that plaque can absorb calcium ions from our saliva, and as it absorbs those calcium ions, it becomes a calculus. And once we have those calculi build up, or those hardened plaques build up into our mouth, it's very difficult to get rid of them. We can occasionally go to the dentist, typically, hopefully once every 6 months. You go to the dentist and an oral hygienist will scrape any of your calculi off of your teeth. But some people don't have access to dentists or oral hygienists, and a lot of times they will go years in between getting their teeth clean, and those calculi can become quite large. If you want to see a YouTube video of some enormous calculi being removed from somebody's mouth, click on this link. And it just gives me the EBG. So you'll need to download the class presentation to click on the link, or I suppose you can pause it and just manually type it in. As we're looking at the plaques, the bacteria within the plaques in our mouth are going to metabolize sugars. And as they metabolize those sugars, they take the sugars and turn them into acids. And then those acids are going to release calcium. They dissolve minerals out of our enamel and dentin to form little canals or caries within our teeth. These dental caries are also known as cavities. If a cavity gets all the way deep down into the pulp of our tooth, we need to have a root canal. We need to grind out the entire cavity and then grind out the entire root to remove all of those bacteria. As we look at mastication within our mouth, mastication is the technical term for chewing. I'm going to date myself right now, but one of my favorite movies is Miss Congeniality. I remember there's a scene in Miss Congeniality where the fashion coach is lecturing the lead actress, Sandra Bullock, and how her character is chewing meat, and she's chewing with her mouth open, and he refers to it as a half-masticated cow rolling around in her mouth. This mastication or chewing process is a form of mechanical digestion. And as we mechanically digest our food, it increases surface area, so we can expose more digestive enzymes to more food. This physical digestion is also going to stimulate some oral receptors that, or excuse me, food in our mouth will stimulate oral receptors that triggers an involuntary chewing reflex. When I was in elementary school in 3rd grade, we had a contest once a month. My classroom teacher would give us all a lifesaver, and whoever could keep the lifesaver in their mouth the longest without chewing it up would win. And I would lose. I'd make it like 10 seconds before I'd chew up my delicious tasting lifesaver. And one of the things that a lot of people struggle with, especially young children, is they have a very strong chewing reflex when they have food in their mouth. Oops, too far there. As we look at the salivary glands, our salivary glands make saliva. And the purpose of saliva primarily is to moisten our mouth. And we need a moist mouth to help us masticate our food and to keep our oral hygiene high. Saliva actually has quite a few antimicrobial compounds within them. Our saliva contains digestive enzymes to help us begin starch and fat digestion chemically. Our saliva cleans our teeth, and it will also inhibit the growth of bacteria. And our saliva is a medium that we dissolve food molecules in and then transport those food molecules deep down into the lingual papillae so we can get them to the taste buds and actually taste what we're eating. To taste something, you have to dissolve that something in your saliva. Our saliva is also going to moisten our food, and as it moistens our food and we physically digest our food, or excuse me, mechanically digest our food by chewing on it, that saliva plus the chewed up food forms this slimy mass. And that slimy mass has a name. It's called a bolus. And we want that bolus to be swallowed down into our stomach. So as we look at the bolus, it's a mass of chewed up food mixed with saliva bound together. It's soft, it's slippery, it's kind of, well, you know, it's a wad of chewed up food. And that's what we swallow down into our stomachs. As we look at the salivary glands, in the lab, there are 3 salivary glands we're asking to know, all 3 actually. We have the largest one, which is the parotid gland, which is superficial to the masseter. We have the sublingual gland, directly inferior to the tongue, and we have the submandibular gland, which is going to be slightly more lateral to the sublingual, to the sublingual salivary glands. That's all we have for this recording. If you have any questions or comments, please feel free to post them on the discussion board or shoot me an email. And as always, happy studies.